You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, we have a pulmonologist in here, Dr. Rutland. We're talking about quitting smoking when you've already been diagnosed with COPD or emphysema. According to Dr. Rutland, there's a lot of people that even with that diagnosis, they still don't quit smoking. Is that correct?
Yeah, it's correct. They don't quit smoking. And I think the main reason that they don't quit smoking is maybe they don't feel those symptoms as much. And the symptoms I'm referring to are the cough, the shortness of breath, the wheezing. And so they continue to smoke because they feel like it doesn't have any effect on them, when in fact it does have an effect on them. And I can see that in some of the studies that I order. And so I think getting them to quit smoking can be difficult, but you can do it. You just have to see the patient frequently, and you have to constantly remind them, and you have to use examples. I have to use examples of patients walking down the hallway. So when people come to my clinic, I've got several people waiting to see me. I've got patients that are on oxygen. I've got patients that are really weak. And it's perfect when I have a 45-year-old patient that smokes a couple of packs of cigarettes a day in my office and who just left his chair was an 80-year-old patient that continued to smoke a couple of packs a day on 6 liters of oxygen, and he can't make it down the hallway as well as he would like. That is a great example for that younger patient. And I had that happen Monday morning. Guy looked at me, he said, "Dr. Rutland, is that gonna be me if I don't quit smoking?" And I turned to him and I said, "It very possibly could be." He took his cigarettes in the trash.
Are there any statistics that people with COPD, they don't have emphysema, but the smoking can heighten their chances or increase their chances of emphysema?
Yes, of course. So again, when we take everybody who is 65 years old, we have statistics of how long your average survival is going to be if you continue to smoke, if you used to smoke, if you didn't smoke, and based on how bad you breathe. And it depends. If you continue to smoke, and you have bad lung disease, you're gonna live shorter than somebody who never did. If I get you to quit smoking, that lifespan goes up. It goes up.
So if you have emphysema, you're saying that every week, maybe, you have people that have been diagnosed with emphysema, and they still smoke.
Correct.
Okay, and you can't talk them out of it.
Right.
Is it, because I've heard somebody say this, well, it was actually not in person, but I saw it on TV, that they're saying, well, if I'm gonna die anyway, I'm gonna enjoy myself. I'm gonna smoke cigarettes.
And I think
what do you say to that person, by the way? Because is that what they tell you?
That is exactly what they tell me. And it's funny that you use the word enjoy, because we all know what enjoy means. Enjoy means we're smiling, we're laughing, we're enjoying life, we're going and we have a great quality of life, we're doing things. That may not necessarily be the case if you continue to hammer on your lungs and your lungs continue to deteriorate. I can tell you, and listen, it's not the prettiest thing to look at, but there are patients that made that decision and they're not enjoying life as much as they could because they continued to do that.
Okay, so these people, emphysema, they're saying, but if I'm gonna die anyway of emphysema, why not smoke, right? They enjoy it. But if they quit smoking, they'll be able to breathe better. They'll have more energy. When you're breathing better, you oxygenate, I'm guessing. So they can walk and run and maybe even go to the gym and things like that. So they'll have a better quality of life. So if they're gonna live another 30, 40 years, which you say with emphysema, you can, right?
You can.
You could be in your 50s and live to be 90 with emphysema.
You can.
Okay. So the quality of life part is what, energy?
Yeah, energy, being able to walk up steps, being able to hold your grandkids, being able to keep up with your grandkids. That's what gets people a lot too. I can really get somebody to quit smoking when I start talking about their family. That's why I encourage family members. When the patient comes to my clinic, I encourage them to bring their family members because I ask them simple questions. If the guy is 45 years old and he comes into my clinic and he's with his wife who wants him to quit smoking, I ask him, I said, what if your 12-year-old was smoking on your dinner table when you came home? And you know what they all say? I haven't had anybody not say this. I would be extremely upset and I would kick his you know what.
Okay.
That's what they say. And at that moment, right away, they seem to kind of, a light bulb goes off and they're like, oh, okay. If he wants me, when he's talking about in terms of enjoying life, he's not just talking about myself. He's talking about me and my family and my kids and my grandkids and my great grandkids going forward. because watching your relative go through something like emphysema when they continue to smoke is very difficult to watch. And I can tell you from personal experience, you know, I've got a mother-in-law that smokes and she's going through that. And it's not...
She has emphysema?
She has emphysema.
And you can't talk her into not smoking?
I can't.
And you must have a pretty good speech, a quit smoking speech, right?
I do.
Because you give it every day.
I do. I've been with her daughter either by marriage or by dating for 10 years.
Maybe because she knows you.
Probably.
It's hard. They don't like to take advice from people they know.
That could be it.
But how would her life change, or anybody's life change?
She's already told me. She's already told me.
But if she stops smoking, how would it change, in your opinion?
So in my opinion, this is what happens. When you smoke, again, you're stimulating all of your receptors within your windpipes to produce mucus. That mucus gets produced, and what do? You cough. You're coughing up mucus. That's one of the symptoms. Second symptom, you're also stimulating that muscle to constrict. What do? You wheeze, right?
Okay.
So now you're wheezing and you're coughing. Every time you get up or every time you want to increase your heart rate to go do something. If you stop smoking, I guarantee you within 30 days, those symptoms are gone. They're gone. Absolutely.
And more
gone.
energy.
More energy, able to do things, not wheezing. You're doing all kinds of things.
Do they sleep better?
Oh my gosh, yes. Yes, because they're not coughing. They're not coughing. They're not waking up to cough. They're not going to bed and coughing. It is proven. I mean, this has been proven time and time and time again. It's been proven. Now, when you smoke, again, because you're damaging your lung, it can lead to other problems like heart problems and things like that.
Are there medications you could give them to help them stop smoking?
Yeah.
I mean, I see them advertise things like that, but as a pulmonologist, is this something you do?
Yeah.
So this is your space.
This is what I do,
Okay.
yeah. There's nicotine replacement therapy. So the big thing in cigarettes is nicotine. That's what keeps people addicted. There's actually muscarinic receptors in the body that the body uses where nicotine can act, and that's why people get addicted to cigarettes.
Okay.
So what you can do, the first thing you do is you try to get somebody to quit cold turkey, because that's been proven that that's the best because it's really all up here. If you can get somebody to quit cold turkey, you're done. If you can't, then you start using nicotine replacement therapy. You see the gum, you see the patches, the lozenges, all those kinds of things, and they are going to give you, you're probably going to have twice a better time quitting with the nicotine replacement therapy than if you don't use the nicotine replacement therapy. Then there are certain drugs that we can use. In combination. One of the popular drugs that we use is Wellbutrin or bupropion, which is actually on the market as an antidepressant, but we also noticed it reduced the cravings of cigarettes and of nicotine in smokers, so we use that. And then the most popular drug these days, everybody comes to my clinic, they want a drug called varenicline, or the brand name is Chantix to help quit smoking. And that does something too.
Because of the commercials.
Because of the commercials.
All right.
It reduces the cravings, and it also, if you were to smoke a cigarette, then you don't get that pleasure that you would normally get and if you didn't smoke a cigarette. So what happens with smokers, if they just use nicotine replacement therapy or they use bupropion, they might quit for a while and then they smoke a cigarette and they get this pleasure from smoking a cigarette.
Okay.
But if you use Chantix, that pleasure is gone, so they're less likely
I see.
to go ahead and smoke that
Now, what
cigarette.
about these artificial cigarettes?
Yeah, that's a good question. So the jury is still out on those. And
Well, what do
here's-
you think?
So what I think about those cigarettes is I say in my clinic, anything to get you to quit smoking the cigarette, but I want you off the e-cigarette as well within maybe a year. And here's why I say that. We don't really know the chemicals that are in the
But does it
e-cigarettes.
cause the inflammation?
So I think it could. And the reason I think it could is because, again, you're inhaling something that your body is not used to inhaling. If I were to be in Los Angeles on a bad smog day, if I take that big breath in, I'm gonna cough, right? So an e-cigarette, I kind of look at that as the same. It's something that you're inhaling that may irritate your airways. Everybody's genes are different. Everybody has different DNA, so you don't know. But I would say if you use the e-cigarette and you cough with the e-cigarette, it's probably causing some inflammation in that airway. But I do use it to my advantage because I'd rather have somebody doing that than doing the cigarette.